Receiving a cancer diagnosis can be a very lonely experience, but at Nebraska Medicine, a simple walk is helping ease the stress and sadness for patients during their stay. 3 News Now reporter Alexa Ray visited with patients to show us what the walking program is all about.
When it comes to treating cancer, there are a lot of finish lines that patients cross. For example, the last chemo treatment or the last diagnosis. But one finish line on this floor is motivating patients to get up and walk.
A simple walk can do a lot for a patient who has been diagnosed with cancer. But finding that motivation isn't always easy.
We had a lot of people that would walk the halls, but it was difficult to get everybody walking.
Giselle Toltze is a nurse in the special care unit at the Buffett Cancer Center, and she decided to come up with some sort of incentive to get patients up and moving. This May, she started a walking program where patients are encouraged to do laps around the unit.
And I think there's a psychosocial component also that, staying in your room all day doesn't really help, motivate you to get better. So getting out and talking to people that may be going through the same thing as you are is so much better than talking to us about it.
Each lap equals a mile, and donated medals are handed out to patients who complete a 5K, a half marathon, and a full marathon. 26-year-old Lucas Souza was diagnosed in February with an uncommon type of lymphoma that affects the brain. After 8 rounds of chemo and a stem cell transplant, he is now in recovery. So far, he has completed a 5K.
I'm not a huge exerciser outside of here, so it was nice to be able to push myself to do something that I can be proud of.
His goal is to get to a half marathon before he is released.
I figure if I do about 10 laps a day, which equals out to about a mile, I should be able to hit there.
Souza says walking has helped him see that he is not alone in his battle. Also fighting is 61-year-old Robert Turk. He was diagnosed with lymphoma in 2014. He has completed 22 laps since he started walking Friday.
I go till I get tired and then we start all over again.
Turk says, like Souza, going for a simple walk makes him feel less alone and prepared to continue his fight.
It's unbelievable seeing people going through the same stuff or worse, than I am right now. Everybody's still trying and we're all working on it, that's for sure.
And keep working on it. The best to them. Since the program started in May, 4 patients have completed a full marathon.